So I've actually written a few articles on what Trump has done in his executive order as president. Basically, what he's trying to do is destroy Obamacare so that it fails. So all on the campaign trail, for a long time, he said Obamacare is in a death spiral. It's going to fail. It's a failure. But it's working, and it's been working. So what do you do in that case? You tamper with Obamacare and make it so it fails. You make it fail, and they say, see, I told you it was going to fail, but you destroyed it. So what is this all about? And this is going to get into this story here. Basically, there are these things called cost-sharing subsidies that insurance companies receive from the government, what a subsidy is, for keeping low-income earners and enrollees, low-income enrollees on Obamacare's co-pays and deductibles lower. So the law mandates that they keep that lower, but the insurance companies, if they do that, they're going to have to basically inflate or just increase the premiums of the middle-class enrollees. Because they have to cover their bottom line there, supposedly anyways, but that's what they're going to do. And so what the government does is they give them subsidies, the insurance companies subsidies. Those subsidies then cover the losses that they take for keeping the low-income enrollees' co-pays and deductibles low. So what is he doing now? So already from the jump, okay, before this, right, what he did was he said, you know, I'm not making a long-term commitment. I'm not saying for a year we're going to pay this. I'm going to pay it by month. So when I saw those stories, and when you saw those stories about, I believe it was, I want to say Aetna, but there were some like insurance companies that pulled out, and you know, lawmakers from both sides like, yo, Obamacare is like fucking up right now. We need to do something. I was like, what is going on? It seemed to be fine, all right, all this time, and now this is happening. What the fuck is going on? And finally, I understand what happened. So basically, with these cost-sharing subsidies being paid month by month, and they know, those insurance companies know, like, yo, Donald Trump doesn't like Obamacare, and he's an asshole. So we're afraid that he's going to pull out and stop paying the subsidies that helps us cover the losses we take for keeping the co-pays and deductibles of the low-income enrollees low. So they're like, yo, we got to dip out of the exchanges because this is not going to be beneficial for us. This isn't going to be beneficial for us, or we're going to have to increase the, you know, the middle class people who don't qualify for the low copay and deductible protection in the ACA. We're going to have to make their premiums jump. So that was why they were pulling out, and I didn't know that for a hot minute until now. So it's been a hot minute. But so basically what you have now that he completely stopped it, he completely halted it, is what's going to happen is you're going to make Obamacare go into death spiral, you jackass. So what's going to happen is, like I said, a bunch of insurance companies are going to dip out of the exchange and be like, yo, we got to go because this is not beneficial for us. And the ones that do stay in the Obamacare exchange in the market, they're going to make middle-class earners who are enrolled on Obamacare who don't qualify for the protections given by the Affordable Care Act of keeping your co-pays and deductibles low. Their premiums are going to go through the roof. So when people say, you know, oh man, the premiums are skyrocketing and all this stuff. Yeah, dumbass, it's because you guys are making them skyrocket. Anyway, so let's get into the story. I really want to explain that to you guys. So pro-Trump states are the most affected by this healthcare decision. So let me see. So it says nearly 70% of those benefiting from the so-called cost-sharing subsidies live in states Trump won last November, according to the analysis by the Associated Press. The number underscores the political risk for Trump and his party, which could end up owning the blame for increased cost and chaos in the insurance marketplace. And it goes on to explain in this AP article. But it says, an estimated 4 million people are benefiting from the cost-sharing subsidies or payments in the 30 states Trump carried, according to analysis of 2017 enrollment data from the U.S. Centers of Medicare and Medicaid Services. Of the 10 states with the highest percentage of consumers benefiting from cost-sharing, all but one, Massachusetts, went for Trump. So what they're saying is the vast majority of the 10 states with the highest percentage went for Trump, who are benefiting from these cost-sharing subsidies. So what you're going to have is a bunch of people in those areas are going to get fucked because their premiums are going to go through the roof, and some of them won't even have health insurance because the insurance companies will just pull out of the exchange. Guys, if you have not enough or no insurance companies, you can't get insurance through the Affordable Care Act. So this is a big problem, and it's really fucking stupid what they're doing. And this is really dumb. And as I explained, what they're trying to do is destroy Obamacare so that it fails. Support independent progressive media by leaving a subscription down below. Leave a like and share the video. Help us out on Patreon, or you can donate in other ways. Links are in the description down below. We are fighting Trump tooth and nail, and we will continue to do so with your help.